Um, okay, great. So we're going now. Couple things before we get started. If you haven't done so already, please introduce yourself in the chat so that we have an idea of who our audience is today. If you have any questions during the presentation, Kathy, should they wait till the end or can they do it as we're going?
Absolutely interrupt me.
Okay, interrupt her. You can use your mic or you can put it in the chat. I'll be watching that. And then as always, we will have an evaluation for you after the program. So keep an eye on your email for that. But without any further ado, then I'm going to turn it over to Kathy. Go ahead, Kathy.
Thank you, Nikki, very much. Gosh, the pressure's on if I'm going to get evaluated even. Yes, please interrupt me. I put together a little presentation for what I think you want to know, but I really don't know what you want to know. So if I miss anything, don't hesitate. Let's just have a conversation about the center and what we do, and we'll get started here. So now it won't advance, Nikki. There it goes. So I put together a few statistics for you. 1 in 4 girls and 1 in 6 boys are sexually abused before the age of 18. 70% of all reported sexual assaults, including assaults on adults, occur to children 17 and under. And the median age for reported abuse is 9 years old. We serve 0 to 17 here at the center. The 9-year-old median age is a little old. I would say our median age ranges probably closer to 7. We see a lot of little kids. So what is a Children's Advocacy Center? This is sort of the fancy description of what a Children's Advocacy Center is. And I'm not even going to read it. I'll let you read it, but it's essentially a multidisciplinary approach to the investigation of child sexual abuse and severe physical abuse. What I always tell people is we are the hub of the wheel, so to speak, and there are several spokes on the wheel. And those spokes have to be the state's attorney's office, law enforcement, DCFS, mental health, and the merit program, which is our specialized medical program. So these are the groups that we all work with to coordinate these investigations. So this diagram was put together by one of our sister advocacy centers in Ohio, and it helps to describe what used to happen before Children's Advocacy Centers existed. So this tells the story of a little girl named Robin who goes to school and tells her teacher that something happened at home. And the teacher does what she needs to do and reports the abuse, but Robin then has to talk to all these people that are separately involved in the investigation of her disclosure. By the time she's through the investigation, she could have talked to upwards of 15 people. Now, you and I both know that these incidents that these children are describing are very difficult to talk about. So if I were to ask for a volunteer right now and who wanted to tell me the story of their last sexual experience and tell it to 5 different people in the group, I'm guessing you probably wouldn't want to do that. So yet we were asking children to do this with multiple professionals that they didn't know and strangers. So certainly that experience was re-traumatizing the child to have to tell that story over and over again. Once the advocacy centers were created, then we were able to streamline that process. And a little girl like Robin would only have to tell her story to one person who was trained to talk to her and knew what questions to ask, while everybody else who was a part of the process or needed to know Robin's story were perhaps sitting on the other side of a one-way mirror. So Robin hopefully only has to tell her story once. And I think we can all figure that that helps alleviate any trauma that might be caused from having to tell it over and over again. So you might not know that Carrie, Lynn is one of 40 children's advocacy centers in the state of Illinois. We're actually one of about 800 across the nation. So there's lots of advocacy centers out there. There's several in Northern Illinois. There's one in Woodstock. There's one over in McHenry County. There's one in DeKalb. There's one in Dixon. So we're surrounded by them and we all work together. We all serve very similar, or provide very similar services. but we are very community-based, and each one of them might be a little bit different, but we're providing the basic core services at each one of them. This is our advocacy center. If you haven't seen it, I'm guessing most of you have. We're on Main Street. We're right across the street from Burpee Museum. You're always welcome to come for a tour if you'd like to. I think the Advocacy Center kind of shows itself, and I enjoy giving tours. So please reach out if you want to do that. But to give you a little history of the Advocacy Center movement and how it became what it is today, it actually started in the late 80s in Huntsville, Alabama. A visionary district attorney named Bud Kramer had envisioned a home-like environment where children could come as a part of an investigation, and everybody would work together on behalf of that child. And that was the first advocacy center. Luckily, we were right on the cusp of that. At the time, Paul Logley was state's attorney, Catherine Zienoff, Judge Zienoff, some of you probably know. Several people began to look at how these cases were being handled in our county and what we could do to improve that response. And they put together the initial protocol, which was in 1990. This made Carrie Lynn Center, well, the Children's Advocacy Center project at the time is what it was called, one of the first in the state of Illinois, behind DuPage County. Kane and Sangamon were right about the same time as us. So we were one of the first advocacy centers in the state. At that time, the interview rooms were located at an agency called Family Advocate, which was over on Church Street, which no longer exists, unfortunately. And the staff were at the state's attorney's office. We're also lucky in the state of Illinois to have what's called the Children's Advocacy Center Act. And it was completed in 1989. And it actually mandates that every county in the state of Illinois has a protocol in place to address these types of cases. It doesn't mandate that there's an advocacy center, but it does mandate that at least the professionals that are involved in the investigation of these cases are working together and looking at ways of working together on these cases. It does allow for some funding for Children's Advocacy Center, but we are lucky in Illinois that we have every county, which is 101 counties in the state of Illinois, covered by an advocacy center now, with 40 of them serving. So we began actually serving clients in 1991. And the Carrie Lynn Center was established in 97. The building that I'm in right now was renovated in 1997 and named for Carrie Lynn. And people always ask me who Carrie Lynn was, and some of you may already know, but if you Google the name Carrie Lynn Gaines, you will find a lot of information on her. But in short, Carrie Lynn was a 22-month-old who was abused by her stepfather at the time. And he ultimately killed her over the course of several days. With the knowledge of her mother. Her mother's name was Sherry, and they together put Carrie Lynn in a box and buried her in the backyard of their home here in Rockford. And Carrie Lynn was there for 5.5 years before someone, from what I understand, an anonymous tip, led them to her body, and they were able to recover her body. And ultimately, they did bring him to justice. He was prosecuted and found guilty. Unfortunately, that was turned over on appeal, but then he did plead guilty and spent some time in prison for this crime, but he was released from prison on Good Friday of 2018. So he is out, but that's the story of Carrie Lynn. And the idea is that no child should ever be forgotten like Carrie Lynn was. And so that's why they named the center for her. So the purpose, which I already touched on a little bit, was to reduce any potential trauma that could be experienced by a child victim. So what we're hoping to do is we hope that we're minimizing the number of interviews that a child has to go through. Our goal is that only one interview with everybody who needs to see that interview sitting on one side of the one-way mirror. And the person who's doing the interview is someone who's trained and knows how to do the interview, knows how to talk to kids, knows how to do a non-leading, non-interrogative interview. These interviews are all about the child. We call it the child first mantra. We are not here to force a child to talk to us. We're here to allow the child to talk if they choose to talk. And our interviewers are trained on what questions to ask and what questions not to ask. and how to allow the child to tell their story if they choose to tell their story. We have plenty of kids who choose not to talk to us. We, certainly have kids that walk out of the interview room where we all feel sick in our stomachs because we know something's going on, but we are not going to force a child to tell us something if they're not choosing to tell us. So that interview process is critical. And if we can make that as child-friendly as possible, then we've done our jobs. So obviously the child-friendly environment, we're in an old house. The advocacy centers across the state or across the nation really are set up differently. Everywhere you go, there's some that are in office buildings. There are some that, are part of hospitals. There are some of the states, the state's attorney's office. They're all different, but the goal is to make it at least as child friendly as possible with happy people and friendly places, colorful rooms and books and toys and those kind of things. And then our goal is for all of the investigative agencies to work together. So, we pull together those key people, the DCFS, law enforcement, state's attorney, but our hope is even when we're not pulling them together, they will continue to work together on behalf of this child. And we're helping to create relationships between those agencies so everybody knows each other and trusts each other and can rely on each other to conduct these investigations in a child-friendly manner. Then we're also helping to provide training to all of our team members and making sure that they know what the best approach is and how to handle these interviews and how to talk to children. And, a lot of times police officers don't learn that at the academy, don't learn how to ask questions and how to work with kids. And so if they're going to take our cases, then we like to know that they're at least receiving some of that information, some of that training, or certainly that they're accessing it. So there's a lot of advantages, we think, to doing cases or handling cases this way. Again, we're making sure those team members are working together, but we're also hoping to ensure that the decisions regarding the cases are quicker, that families aren't drugged through a long process, that we come to a decision as fast as possible so we can focus on the children that truly need our help. And the children that don't, perhaps it's a case that it was a false report or there was some reason that a report was made that's not accurate, then those families can move on and that we're not intervening in families that don't need us. And so that families are not subjected to this prolonged investigation. And of course, with doing it that way and making sure there's quicker determinations, then we're trying to save money for the system. And by doing it in a streamlined process, then we're hopefully keeping those costs down. So, if we can increase the quality of the investigation, then it stands to reason that we can increase the chances for a successful prosecution. Prosecution is the icing on the cake on these cases, but the vast majority of our cases never see a courtroom. Most of our cases don't need to see a courtroom, but the ones that do, we want to make sure that we're doing a very quality investigation. We're putting together all the pieces, that we're providing the support we can to the investigative process so that once the prosecutor's office decides that they're going to push forward with charges, that they have a case that they can win. That they can win on behalf of these children. And so it's a huge goal for us and certainly something that's very important to us. But we also understand that many cases don't ever see a courtroom or should see a courtroom. And you also have to remember that there's lots of ways to intervene with these families. And really the ultimate goal for any of these cases is child safety. And what do we need to do to make sure that this child is safe, that this child never goes through what they went through. And so, if we can do that in other ways besides prosecution, then we've won. And certainly there's other courtrooms besides the criminal courtrooms that you guys all are more aware of than I am, that we can help to impact these families. But if we can make sure that children are safe, then really that's what we got to do. So these are some important details that everybody needs to know about our cases and things that might be a little bit confusing. So our referrals only come from law enforcement or DCFS. We're not investigators. my staff are social workers and we have no authority to make any decision. So we're here to support the process. So it has to be a law enforcement involved or a DCFS involved case in order for it to be referred here. Of course, we get cold calls. We call them cold calls, like I'm sure you do all the time, about, from people who say, well, I think my neighbor's being abused. Can you do an assessment, or can you come in, or can you? Well, we can't. But what we do with those calls is we obviously try to help guide people on how to respond and what do you do to make sure that kid is responded to in an appropriate way. And if a report is made to DCFS or law enforcement, then it's going to come here. So that's the first step. We take all child sex cases. So any child sex case that you see on the news, or that come through maybe the system that you're involved in, it most likely has come to the center. That protocol that I mentioned in the first few slides includes the fact that all child sex cases have to come here. Now, some, I suppose, get bogged down the system and maybe we don't get, but certainly that's the goal, is that all of them need to come here. We take severe physical abuse cases. So when I say severe, some of you old timers remember the old priority 1 cases with DCFS. So the really bad stuff like the subdurals, severe head trauma, severe burns, all the way to child death. Those cases are all referred to us. And then we also take, in more recent years, the human trafficking cases, and seeing more and more of those, of course. We serve Winnebago and Boone counties only. The other thing that we've become known as over the last few years especially, is the people that know how to talk to kids. So we've been getting a lot of referrals of child witnesses to violence and child witnesses to DV. So we're doing more and more of those interviews and able to provide support and services to those families as well. So let's talk about some of our services. One of the benefits is that it's immediate coordination. So as soon as we get the case, either from law enforcement or DCFS, we're able to, let's say we get it from DCFS first, then we're able to send it over to the sergeants who assign it to a detective, and vice versa. If we get, a case from law enforcement, we're able to say, has DCFS been called? This is a caretaker. We need to make sure DCFS is called. So we're able to make sure everybody who needs to be involved in these cases right at the onset get involved with the cases. The first thing that generally happens in an investigation is the forensic interview. We take 0 to 17, but obviously not 0 to 17 can be interviewed. So we can't interview an infant. So what we focus on, usually it's about 3 years old that can participate in an interview. People will say, but she's verbal and she can talk. Well, yes, but can she answer questions? Can she participate in an interview type of setting? And a lot of times with younger children, that's not possible. And certainly in cases of child death, we wouldn't be able to do an interview. But what we do a lot of times in those cases is maybe there's a sibling, a child witness of some sort, then we can do those interviews as well. But that's the first thing that happens. Everybody comes together at the center and as a part of the interview process. We have 3 interviewers on staff. Actually, we have 4 people trained to do interviews. We have 2 that all they do is interview. That's their only job. There's certain requirements through our standards that interviewers have to be trained. They have to go through a nationally recognized training. Then they have to go through training every year, as well as a peer review process. So our interviewers are constantly learning and constantly improving their skill. And we do train some of our team members as well, just as a cross-training process, so that they understand the interview process and can be on the other side of that mirror and understand why the interviewer is doing what they do. So the interview is really the core of the first start of the process and sets the investigation in motion. From that interview, we're able to make medical referrals. We have a specialized medical program named Merit. Merit was born here at the center. We have a medical site right here at the center. And if we know a child is going to need an exam, then we're able to have Merit come to the center, and we can do that all at the same time. Do the interview and then do the exam. A lot of times, the physical abuse kids that we see, because we're seeing the worst of the worst, they will have already seen a doctor, and usually they're triaged, and injuries are such that that medical exam has to happen before the interview. But the sexual abuse exams we're able to do right after the interview if we need to, or we can make a referral over to the merit offices, and that has worked very well. Not all children do a medical exam. It's decided upon by the team. It depends on the disclosure. It depends on the child. But that that is an important evidence gathering process sometimes. But we also know that there's not always evidence of these crimes. So, but that's what merit does. They provide that expertise, and they're able to provide the court testimony and the work with the team to educate the team as to what they find in those exams. We have court advocates on staff. I have 2 full-time advocates, Linda and Tanya. Some of you may have met them. They meet with the families from the time of the forensic interview. So right off the bat, they're talking to the families, providing support, answering questions, making sure that the family has referrals for counseling, whatever they need. From that point forward. And then that person becomes, the advocate becomes their contact person moving forward. If the case is charged criminally, we do what's called a case review process here at the center. We do it every Thursday. Every case that comes to the center goes through this process. And the case review involves everybody who was involved in the case. So prosecutor is here, the DCFS worker, the detective, one of our therapists, the advocate, the interviewer, and they discuss the case and they make decisions about child safety and what needs to happen to make sure the child is safe, but also whether there's going to be criminal charges. If there's charges, then that advocate who met with the family takes the case and follows that family all the way through the court system. A lot of times we can be involved with families for a long time. Obviously, sometimes those court cases can drag out and be with us for quite a while. So they get to know those families, our advocates get to know those families pretty well. But during that time, we're also able to provide referrals and support and whatever we need to do to make sure that the child is doing okay. I included some pictures of the center. So these are interview rooms. This is the observation room. So this is the side of the room that the team sits on. We record every interview. That system that you see in the picture is the iRecord, which is our old system. We just put in the Axon system, which is all digital now. Very excited about that. We're able to provide now, we don't have to do DVDs anymore. We're able to do links, and it's just made the process so much better. But you can see the microphone in the room. The interviewer wears a little bug in the ear that allows the team to talk to the interviewer. The interviewer is obviously trained on how to do the interview, but there may be some details. Law enforcement and DCFS are often looking for very different things from the interview and very different details. And so, if an interview needs to follow up on something the child said or some kind of thing, then they're able to talk to the interviewer without stopping the interview, which just keeps it moving forward. So that's the interview or the observation side of the room. A lot of other CACs, it varies with the CACs. We're lucky enough to have the mirrors. We like the mirrors. Other CACs will do it with closed circuit, where the observation room is in a completely different part of the building sometimes, and the interviewer and the child are in another part of the building, and then they're watching it on a screen. So that works really well too. And you also should know that this is a very closed process. Only the people that are involved in the interview process or in the case can even be in the observation room. So mom and dad can't be there. Attorney so-and-so can't be there. There's several reasons for that. One is that if the child knows that someone else is in the other room, or if maybe a family member's there, that might delay any kind of disclosure we might get out of an interview. We want to make sure the child is as comfortable as possible, and certainly is not feeling like they have to protect people that are in the observation room. Also, anybody who sits in that observation room is open to subpoena. So if they're observing an interview and it goes to court, they very much could be subpoenaed to court, and we try to avoid that. as much as we can. This is the interview room where the child and the interviewer sit. This is purposefully stark. We don't want any distractions. We want it to be child friendly and comfortable, but not have a bunch of things that the child gets distracted by. So a few of our other services. I mentioned earlier that we have therapy on site, and we have 2 therapists that are able to see the children right away. We offer this service to any child that comes through the center as a part of the interview process. And referrals are made obviously based on need, but immediately at the time of the interview. If the family doesn't follow up with our crisis intervention therapist, then a lot of times we will follow up with the family and just make sure that they're okay. We also, those therapists will make referrals out into the community. We have a wonderful relationship with several counseling agencies, most especially Rockford Sexual Assault, and we can make referrals if that's where the family would rather go. Our crisis intervention process tends to be more short-term. Our hope is that kids don't have to go on waiting lists. We can get kids in right away, start that healing process immediately. And then if the child needs to go into long-term, we're able to make those referrals and do those transfers. We do have some kids that stay long-term here, but our hope is just that kids that we can avoid waiting lists if we need to. And then we do some community education. We've gone into the schools throughout the years. We've got a program that we use. It's called A Good Rule to Know. No one should touch private parts of your body unless it's to keep you clean or healthy. And we've provided that to the schools through Aaron's Law in the past. And we've trained several social workers to do that program. But we also go out and talk to other groups, churches, and various things. And we're always happy to do that if you need us to or want us to. This is just some more pictures of the center lobby. More of the lobby. This is our play therapy room the therapists use. And this is one of our counseling rooms upstairs. So we're busy. We're one of the busiest centers in the state of Illinois. These are the statistics for FY22. This was kind of a slow year, in fact. FY21 was 764 referrals. So it ebbs and flows, but we pretty much always stay in the 600s. We do anywhere between 300 and 400 interviews a year with 2 interviewers. That's a lot. But we all know that that children don't always disclose abuse. You know, I've heard numbers as low as 10% of children will ever tell that they were abused. You know, these disclosures sometimes are more painful than the actual incidents themselves, or can be as painful. And many times, you know, 95% of the abuse cases we see are done by someone the child knew. And many times it's, you know, someone in their life that is the most trusted, loved person in their life. So there are more reasons not to tell than there are to tell in these children's lives. And telling someone, you know, usually in a lot of these cases, they just want the abuse to stop. They don't want to get somebody in trouble. They don't want all of the trouble that comes from all the problems that are created once a disclosure is made. And so for children to tell is a remarkable thing. And the strength that shows, and then to have to come into the interview process and tell again. And it's, you know, if you consider that 601 disclosures are just 10% of all the cases out there, it's kind of a scary thought. So if we were to talk about abuse and some of the signs, you know, there's no way for me to say there's one definitive sign. It's not a litmus test. There's not, you know, there's multitudes of ways to, you know, to look at this. And usually what I will tell people is it's extreme changes in behavior. it's things that, that a child wasn't doing before and suddenly is doing, that could be a sign, but maybe not. And so it's hard. But if you have one or more of these signs, or if there's things, that that start coming forward from a child that you just is completely out of the ordinary and unusual, then you do have to ask and question, what in your head, why that's happening, from depression to suicide, eating disorders, or changes in eating patterns. Suddenly they don't want to eat, or they're eating more, or sleep disturbances, nightmares, night terrors, poor hygiene. We had a child, I remember back in the day, she was a teenager, and she wouldn't take a shower, she wouldn't bathe. And when we started working with her, we learned that was her way, she hoped, of deterring anyone from ever wanting to abuse her again. That if she was gross and she was smelling, and she, that would keep her safe. Or the opposite of that, excessive bath time and bathtub bathing. We're trying to get it off of you, and promiscuity, sexualized behavior, early pregnancy, self-medication, abuse of alcohol or drugs, certainly self-harming behavior, suicidal tendencies, but cutting, and some of these other things that we can see with our kids. All of those can be signs of sexual abuse. Running away, anxiety, there's so many. Physical abuse, unexplained injuries. Suddenly they go to daycare every day and everything's fabulous, and suddenly they don't want to go to daycare anymore, or don't want to be around that person anymore. Excessive aggression, anger, an ability to control their anger, regressive behaviors. Maybe they were potty trained and now they're not. Suddenly going backwards in some of those behaviors, or sleeping, depression, again, increased anxiety. Another example I can think of is a child who was being abused by someone at home, and had bruises. So they, in the middle of summer, 90 degrees outside, were wearing their coat, wearing long sleeves to cover up those bruises, and trying to keep themselves covered so they couldn't see the bruises. So some of those kinds of signs. So what can you do? Certainly create an open environment with a child. Be open to the conversation. If a child feels like you don't want to hear it, they're not going to tell you. You need to listen, let the child talk. Don't pepper the child with questions. Don't ask leading questions. In fact, the more streamlined that conversation can be for the child's sake, the better off it is. Let them talk. Just be reassuring and supportive. You did the right thing. It's not your fault. You're not in trouble. I'm going to do my best to help you. All the things you can say to reassure them that what they're saying or what they're doing in that moment is good. And remain calm. If you start sobbing, then I guarantee you're going to shut the child down. So deep breath, remain calm, listen, let the child give you the information that they want to give you. And most importantly, believe. And tell the child that you believe them, and that you're going to take action, that you're going to do what you need to do to help them, whatever you can do to help them, and then do it. Carrie Lynn didn't have anybody that had a voice. Even her mother didn't tell anybody of what he did to her little girl. And sometimes these children just need a voice, need somebody to tell. And people always, people will say, well, but I don't want to get involved, or what if it's not true, or what if I cause problems for the family? Well, you know what, it's not up to you to decide if it's true or not. It's up to the professionals to do that. And what if it is true and you didn't do anything to help that child? So you have to take action immediately on behalf of that child. And the way you do that, this is the DCFS reporting number, 1-800-25-ABUSE. Certainly you can make that phone call. If it's a caretaker, DCFS will get involved. It has to be somebody who's in a caretaking or a power role with the child for DCFS to get involved. But you also can call law enforcement. You can also make a police report. So there's a couple of different ways that you can help to intervene with a child. And if you are ever in a situation where you need help with that decision, or you want feedback, or you want to run it by somebody, then you can call us. And we are happy to help you make those decisions and encourage your process. So that's always an option too. But most importantly, you know, help and be a part of that child's safety. So, and that's do I have any questions?
Thank you so much, Kathy. Do people have questions? You can unmute or put them in the chat. While we're waiting on that, Kathy, I actually had a question. You mentioned about getting a higher amount of referrals for child witnesses to domestic violence. Can you talk a little bit more about that? Like, how are those referrals coming into you, and how does that differ from maybe some of the other interviews you've been doing?
Well, it's a lot different. The child witnesses to violence and has been an experience for us. Usually those are, through law enforcement, and always in the middle of the night. We are a 24-hour facility, and we're open anytime that they need us. But those interviews are what we've been doing is sending our interviewers to more and more trainings on how to do those kind of interviews, because they are different. They are, a lot of times law enforcement needs different things from those kids during the interview process, and needs more detail on certain things that we're not, as educated on. And so that has been something that we've had to learn and work with. But the beautiful thing is they're able to come to the center and not have to go to the police department. They're able to come here, and the interview can be done by, someone who's just knows how to talk to kids and can provide that support. And then we're able to provide counseling and support right away to that family when that happens, and then certainly make referrals to the Family Peace Center and various other places that remedies and some of our other partners that are so important in that process. So it's been a learning experience for us, but something we're really happy that has become a trend.
Yeah, I personally didn't realize that was happening. So thank you for sharing that. Other questions? No. Okay, I'm looking at people's screens here. All right, well, I can say from personal experience that Kathy is very responsive to any questions or things you may need. So please take down her contact information. And I'm sure she's, willing to answer any questions that may come up after today.
Absolutely.
Anything else from you, Kathy?
Thank you for having me. And I really mean it when I say, if you ever want to tour the center, please come by and give me a call, and I'd be happy to do that. So
great. Okay, everybody. If you just hang tight for a second, I will throw the link for the evaluation into the chat. I'll also send it by email, but I'll do it now so you can have it. Here it comes. Okay. All right. Well, we appreciate your attendance today. Hopefully this was meaningful for you. If you have any ideas for trainings, please put those in your evaluation. Otherwise, enjoy the remaining 20 minutes of your lunch hour. And we'll see you all soon. Thank you.